so then we would say, we talked about the athlete who runs, jumps, lands on a basketball court, hears a pop, feels a pop. There can be two areas that can be. They can say, well, I felt my kneecap shift out and pop back in, so that can be patellar dislocation, and or subluxation can kind of ride to the edge. Or if it's dislocation, they say, well, I just felt, I reached down and pushed it, extend my knee, and it popped back in. Or the coach did it, or the ER doc did it. And then they're going to have tenderness along this side, and then they'll have some tenderness down along their femur where the kneecap bumped into that. Those folks that said, I had swelling, and it occurred over that same pop, I didn't feel my kneecap out, and it's swelling like a dripping faucet occurred over 24 to 48 hours. So that's the ACL, because they'll rupture that like a firecracker, and then it drips like blood, like a dripping faucet into the knee. So it's not an immediate effusion, it's over 24 to 48 hours. And so those folks, you'll see, if you get them on the sidelines, you'll be able to check it immediately. Otherwise, maybe so people can see, I'll show it here. Ken, kindly for us, had his ACL ruptured and reconstructed, so he's our model. That's right. So again, so if his ACL was out, you would pull that like a drawer. Now, an anterior drawer test is at 90 degrees. I like to sit on the edge of their foot so it doesn't move around. I tell them I'm going to sit on the edge of their foot because otherwise they pull their foot away. And then anterior drawer is at 90 degrees, and he's got a very firm endpoint that did a great job on that. That's the posterior drawer. That's the anterior drawer. And then the Lockman's is at 30 degrees of flexion. And I like to externally rotate the hips so they relax. And you just pull that forward at 30 degrees. And the anterior drawer goes like that. I have video clips on my computer if anyone wants to see it. The patellar apprehension test. You'll have the patella can translate 25, 50, 75, or 100%. So 1, 2, 3, or 4 quadrants. He only translates 2 quadrants, 1.5 to 2. Kids that go 3.5 and they've recently dislocated their patella, they reach down and grab your hand. I have a picture, a cartoon drawing of the kid's hair is straight up in the air, and that typically doesn't happen. But and then, so that's a patellar apprehension test. You'll get patellar grind or chondromalacia, so you'll feel it. I said, you hear snap, crackle, pop sounds when you go up and downstairs? If you want to feel patellar chondromalacia, come up and feel Ken's knee afterwards. He's got it. So, and then, the other issue is folks that have a meniscus tear, classically they will have pain. You can feel, here's tibial plateau and femur. Here's the medial hemijoint. The MCL is going to be here, medial collateral ligament. Posterior medial hemijoint is right in the back. So they'll hurt right at their posterior medial hemijoint for a medial meniscus tear. And I'll flex and internally and externally rotate the foot, and they'll have pain. And kids, his knee's a little big, but kids, you can feel your index finger here and your thumb on the other side. You can feel both sides. Feel which side clicks, which side has pain. Kids on the lateral side, you got to worry about a discoid meniscus. They'll get pain on the lateral, posterior lateral hemijoint right around the back here, and they'll get they can even, when you're doing this, flex and extend, they'll get a clunk. Their knee will, especially even a terminal extension, they'll get a little clunk in their knee. And so that's discoid meniscus on the lateral hemijoint. So in summary, Osgood-Schlatters, infratellar tendinitis, anterior knee pain, quad tendinitis. The Osgood-Schlatters is down here. Syndig-Larsen-Johansson condition is inferior pole of patella. That's an apophysitis, an inflammation of a growing cartilage center that's turning into bone. The treatment for that is the ABCs, activity modification. If you have pain with limping, it's nature's way of saying you're done for the day. If you have pain with limping 3, 4, 5 days in a row, you got to take a month off and just do your stretching. B is bracing, rubbery type sleeves. Some people love them, some people hate them. If you love them, you can wear them. If you don't love them, you don't have to wear them. C is continued rehabilitation. You make stretching part of your daily routine. Like a diabetic takes their insulin 3, 4, 5 times a day, you do your stretching 2 or 4 times a day. The more you do your stretching, the more fun things you get to do. Notice I didn't say if you stretch today, that tomorrow afternoon at 2 o'clock, you'll be good to go forever. It didn't start overnight, won't go away overnight. So that's not the first time I've given that speech in church. So then we talk about anteromedial hemijoint. There's not many anterior horn meniscus tears. Medial collateral ligament is an MCL sprain. You check that by valgus stress. So they'll have pain when you just pull their foot outward. Lateral collateral ligament is on the outside. So this one, they said a football helmet hit me from the side. This one, they'll get a twisting injury and kind of landed on their knee. And so they'll have pain on that outer side, right in the middle, the lateral collateral ligament. Meniscal posteromedial joint line is medial meniscus. Posterolateral joint line is lateral meniscus. IT band is along the side. Patellar chondromalacia, you'll feel the snap, crackle, pop sounds and hear them. Patellar apprehension is pushing out to the outside. And so that is the primary things you'll see. The last thing I would note is there are kids with OCD lesions, osteochondritis dissecans. So the knee becomes like a soft spot on the apple. So kids due to chronic repetitive microtrauma, it leads to a focal area of ischemia. So I use the analogy, if you push on your hand, it's nice and pink. Kids have good blood supply everywhere, but there's susceptible areas. Gymnasts at the elbow, if they have fluid, water on the elbow, and baseball pitchers, you got to worry about that soft spot. It's at the capitellum at the elbow, it's at the ankle, and it's classically at the medial femoral condyle of the knee. So if we draw Ken's knee, we can draw the patella, and then this is the medial femoral condyle, and they'll hurt. Classically, 75% of the time it occurs right on that medial femoral condyle. So that's that kind of soft spot on the apple analogy. Little kids, they all heal up fine. Big kids, you're 16, 17, 18, typically don't heal those with activity restrictions. Kids in the middle, many do, and some don't. So there's kind of some easy issues for that for us.